John Kanellopoulos, and I'm happy to present to you a very interesting case. This is a patient who had underwent LASIK Xtra, which means collagen cross-linking after a routine LASIK procedure. The refractive error was in the -9 range, and 3 years later she had a residual myopia of about -0.75 that was a concern for the patient. The residual cornea stroma was significant enough to allow us to do a retreatment, and in this video you'll see the actual retreatment following a LASIK Xtra procedure. As you will notice, and I will describe, there's great tenacity at the wound interface. So this will be opened with a Sinski, and at some areas there's great resistance, as well as some higher level resistance, in my opinion, than other routine LASIK cases that we have retreated. I hope you find this presentation interesting, and I thank you very much for your attention. So here's our case. We're going in with a Sinski hook, and see the resistance that the flap edge has at certain areas. You can see the tenacity with which, and I'm putting quite a bit of force here to open this femtosecond LASIK flap that, as I mentioned previously, has already been treated with LASIK Xtra at the completion of the treatment. Lifting the flap, doing the laser, and putting the flap back in place. You can see the nice reapposition, and applanated the flap with a Johnston applanator, bandage lens, uneventful. I'll show you here the other eye, again on the slit lamp, picking up the graft, the actual flap interface, and then lifting, and you can see here the resistance with which the flap opens, possibly depicting a better adhesion with LASIK Xtra. Laser, and then posing the flap using a drop of Pret Forte to delineate the flap gutter and assure that the flap is back in place. Thank you very much for your attention.